Welcome, everyone, and thank you for joining today's webinar. My name is Chris Bondis, and I'm the head of marketing at PatientPing. I'm thrilled to welcome you all to our webinar, Looking Back and Looking Forward, CMS Value-Based Care Models and Harnessing Interoperability for Success. As many of you know, the e-notifications condition of participation included within CMS's Interoperability and Patient Access Rule went into effect as of May 1st. Now more than ever, organizations must ensure they have the ability to share information to succeed under new and existing CMS initiatives. We're excited to walk through where CMS stands on recent value-based care model updates, as well as future goals for creating a more interoperable healthcare system. Before we dive into today's conversation, I'll be covering a few technical logistics. First, attendees will remain muted throughout the webinar. We'll have a Q&A portion at the end where you'll be able to submit any questions via the GoToWebinar control panel simply by clicking the question mark icon on the right-hand side. We will try to answer as many questions as possible, of course, and if we can't get to all of them, we will follow up with any of you whose questions were missed. Additionally, a copy of the webinar recording and presentation slides will be sent to you shortly after the session. With that, I'm pleased to introduce our speakers for today's session. First is Molly Kane. Molly is Manager of Government Affairs. Prior to her time at PatientPing, Molly worked in payer policy at Athena Health, where she led the regulatory review of CMS proposed and final rules and coordinated Athena's operational response to payer and industry changes. Molly holds a degree in government and legal studies from Bowdoin College. Next is Natalie Berkowitz, Senior Product Marketing Manager at PatientPing. Prior to joining PatientPing, Natalie held marketing roles at Biogen and Oxford Immunotech. Natalie holds an MBA from the Boston College Carroll Graduate School of Management and a BS from the University of Massachusetts Amherst. Molly, over to you.
Great, thank you, Chris. And hello and welcome to all of our attendees today. Thank you so much for joining. So as Chris mentioned, the goals of today's webinar will be to review where we are today, as well as some recent updates around where we are going with value-based care models and with interoperability. We'll also make sure to highlight current trends towards further interoperability in the industry and how this can accelerate success within value-based care. And then finally, we will take a look to share key considerations and strategies for success in the value-based care models of both today as well as of the future. All right, next slide. Great, so let's get started. So just to level set on the industry and interoperability and value-based care today and going forward. So in the past year, there have been a number of changes to both interoperability movements and trends, as well as to value-based care and the current models and landscape going forward, with new rules and both being proposed and finalized, innovation models being both created and phased out, and overall just directional changes in the industry favoring a focus on increased care coordination and increased value-based care. So with rules from ONC and CMS, as well as updates from both CMS and CMMI, the industry really does continue to rapidly evolve and push towards an increase of both interoperability as well as the value-based care models that we see today. So a few areas that we'll be covering today and really just to look out for within the industry. The first being some changes to current value-based care models. And then a bit about regulatory updates, things that have passed recently, as well as things to look out for in the coming months and years. And then finally, just overall industry trends in interoperability. Great. Next slide. So before we dive into some recent updates, we'll start with a high-level overview of current high-risk value-based care models. And I'm sure many of you are very familiar with these models already, but to just kind of give a summary of where we are today. So there are two predominant models in value-based care today, and these are the Medicare Shared Savings Program, or MSSP, and the Next Generation ACO model, or Next Gen ACO. And both of these models really look to build upon the Pioneer ACO model and offer increased opportunities for both risk and reward. So on the MSSP side, the two high-risk tracks for ACOs have been the MSSP Track 3, which was introduced in 2016, and then the MSSP Enhanced Track, which was introduced in 2018 during an overhaul of the MSSP program structure. And both of these tracks provide the opportunity for increased levels of risk and reward compared to earlier pathways, with a shared savings potential of up to 75%. Now, moving along, the next-gen ACO model, which was also introduced in 2016, offers a higher risk and therefore a higher reward pathway compared to the MSSP model within the value-based care space for ACOs. So the next-gen ACO model offers two risk-sharing arrangements, the first being an 80% shared savings and losses model, and the second being a 100% shared savings and losses model. And I'm sure many of you are aware that the next-gen ACO model is set to phase out at the end of this year. And we'll be covering more about this shortly, but with this in mind, let's touch upon direct contracting. And so direct contracting is a new ACO model that has just recently been launched, with 2021 being the first performance year. And direct contracting was designed as a successor to the next-gen ACO model. And at present, there are two options being offered, a professional option and a global option. The two options have differing levels of risk and reward, with direct contracting entities in the professional option having a 50% arrangement of shared savings and losses, and direct contracting entities, or DCEs, in the global option having a 100% arrangement of shared savings and losses. And broadly speaking, direct contracting closed for new applicants, with 53 direct contracting entities having been selected for year one, and CMS opting to no longer solicit applications for new organizations looking to participate in the model beginning on January 1st of next year. Now, that being said, let's jump into the next slide to discuss some recent changes as of last week that impact direct contracting participation and specifically next-gen ACOs. So as many of you know, a lot has been in flux with regard to the future of next-gen ACOs, particularly given the closure of new applicants for direct contracting, which had been seen really as the next step for many next-gen ACOs. And because of this, there had been speculation around the possibility of CMS extending the next-gen ACO model. However, on this past Friday, CMS announced that the next-gen ACO model will not in fact be extended and will still end as planned at the end of this year. And that being said, within this announcement, there were additional updates that now create a clear path forward for next-gen ACOs who wish to continue in high-risk value-based care. And so in addition to the overall announcement of next-gen ACOs continuing to sunset this year, CMS in the same announcement also noted that they will be reopening the direct contracting application process for next-gen ACOs who would like to continue in a higher risk track. And it's worth calling out for this that next-gen ACOs will still need to demonstrate eligibility for the direct contracting model. And in regards to that, they will need to submit materials supporting their eligibility by June 14th at the latest, creating a rather fast turnaround time for this step forward. Now, for those who choose not to proceed with direct contracting, or those who are ineligible for direct contracting, another option will be to move back into MSSP. And for this option, the turnaround time is even a bit quicker, with notices of intent to apply being due between June 1st and 7th. So really worth noting and highlighting that organizations need to ensure that they're prepared within the coming days for whichever option they choose. All right, and then going on to the next slide and really switching gears a little bit now, and thinking back to the overall context of value-based care as it relates to interoperability, we will now also cover some regulatory updates that further the trend towards increased interoperability and ultimately drive impact and growth for value-based care models. So on March 9th of last year, 2020, two major healthcare IT rules were finalized: the CMS Interoperability and Patient Access Final Rule and the ONC Cures Act Final Rule. And we'll go over a bit of both of them in a bit of detail, starting with the final CMS Interoperability and Patient Access Rule. So this rule contains multiple final provisions, and really the ultimate intent of the rule overall was to further overall healthcare interoperability. So as you can see on the left-hand side here, there are a number of different provisions that were included, ranging from a focus on increasing patient access to their own information in PHI, to building out APIs of provider directories, to providing some additional mechanisms for reporting of info blocking and provider digital contact information, to payer-to-payer data exchanges, enabling payers to share claims data and better coordinate together on their members as they change from one plan to the next. Benefits coordination for dually eligible members between Medicare and Medicaid. And then finally, this e-notifications condition of participation. And I really want to take a moment to highlight this one, which essentially is a new hospital condition of participation that was included within the rule that says that hospitals must make a reasonable effort to send ADT notifications to post-acute providers, primary care practitioners, practice groups, and entities that need the information for treatment, care coordination, or quality improvement activities. And while this provision that was included within the rule is really meant to be focused on hospitals, I did want to also highlight that it subsequently does have impact for both providers and ACOs. And so with this condition of participation, CMS is signaling a push towards real-time data sharing going forward as an essential component to successful care coordination of patients. And by requiring that hospitals share this information as a condition of participation, CMS is really taking a step forward to ensuring that all providers will ultimately be able to have this timely information to further care coordination, including for value-based care. And one thing to note of this as well is that it did go into effect this past May. So on May 1st of this year, this condition of participation officially went into effect. And as a result of that, and kind of in furtherance of it, CMS has also released some additional interpretive guidance on this condition of participation. The interpretive guidance made a major movement and additional call out for ACOs, where they noted that ACOs and their distribution list should also be considered for information sharing from hospitals on their patients. And while CMS noted that it is not required for hospitals to necessarily share information based on an ACO distribution list in this current iteration of the rule, the note of it within the interpretive guidance really seems to signal that CMS is heading in a favorable direction for ensuring that ACOs are seen as key players within the care coordination space. So it should certainly be something that we look for in the future and anticipate seeing some additional updates and guidance coming out in the coming years that will ensure that ACOs are also brought more into this real-time care coordination consideration across all of the different players within the care coordination space. All right, and going on to the next slide. So now moving into the second rule that was finalized on March 9th of last year. And this rule, which is the ONC's final rule of the Cures Act, implements interoperability requirements that were outlined in the 21st Century Cures Act. And while a large part of the intent of the rule is really to further patient access to their electronic health information, the rule also really does have a focus on enabling increased sharing and coordination for providers. And there are a few major provisions of the rule, which you can see here on the right-hand side. And so the first one being the info blocking section of the rule, as well as the conditions and maintenance of certification, which is the certification update section, which really is also meant to support and be in furtherance of the overall goal of supporting info blocking and mechanisms to prevent info blocking. And then additionally, this rule also provided provisions around EHR data and ensuring that EHR data is being able to be shared across providers and health systems in support of new models of care. So again, bringing it back to that focus of value-based care and ensuring that all providers have the information that they need to further the care coordination and success of their patients. And then finally, this rule also included provisions that ensure an advancement of patient access. So really going back to the concept of making sure that a patient is a part of their own care team and has access to their own information to be able to better coordinate and advocate with their own providers. And really highlighting both the info blocking as well as the EHR data portions of this rule. I'd like to call out just a couple of areas on the left-hand side here where this Cures Act does provide some additional impact for providers and ACOs. And really, at the end of the day, the Cures Act creates a trend towards more information available to providers, really being able to further those care coordination efforts. And as a part of this, and with the EHR data section, it really does work to improve access to charts through improved request processes, as well as creating more flexibility for providers and ACOs when moving between different health systems as well as different health IT vendors. All right, and next slide. And now beyond some current regulations that have been finalized in recent times, I'd like to just cover a couple of other trends in interoperability across the industry. And all of these really work both to increase interoperability as well as provide additional opportunities to support models of value-based care. And so I really think it goes without saying that COVID-19 has had a major impact on all areas of the industry. And one area, though, that seems to be a potential positive coming out of COVID-19 is that it really highlighted the acute need for increased connectivity and collaboration across the care continuum, and particularly the need for real-time information to ensure that providers are able to properly manage their patient panels and better improve outcomes across their membership. In addition to this, another area to look out for within the overall industry and thinking of interoperability is HIPAA, and particularly some proposed updates to HIPAA that likely will be coming out in the future. And so as background for this, the Office for Civil Rights, or OCR, within HHS recently released a notice of proposed rulemaking and comment period to modify HIPAA with really a focus on removing barriers and improving care coordination, as well as taking into consideration more around electronic PHI or ePHI. And the ultimate goals and kind of new provisions within this update to HIPAA will be to enable additional disclosures of PHI to entities that coordinate ancillary and health-related services, as well as broadening the disclosures for health-related emergencies. So really, hopefully, will be another step into the direction of interoperability and ensuring that providers and entities across the care continuum are able to share information crucial for care of different patients. And finally, just a note of really a more overarching trend within the industry, but there's been really a movement to expand upon the different types of care and really to expand upon the notion of the different providers and settings who would benefit and should be a part of care coordination and interoperability, and different information that can be shared across these entities to better support the success in managing different patients. And so we've seen across both different rules as well as overarching just trends across different organizations and interest groups, that there really has been an increased focus on home health and behavioral health, and really recognizing these two areas and types of care as critical to overall patient health and critical to the furtherance of value-based care success. So I'd say it's a good thing to look out for as we move down the path of really increased interoperability and a further focus on value-based care programs, to keep in mind that home health and behavioral health will both likely become an increased player in this space. All right, next slide. So as we can see, there's really a lot changing, both with value-based care and with trends toward interoperability in the industry at large. And really taking a step back, let's talk about what this means for organizations across the care continuum. So taking a look on the left-hand side here, really ultimately value-based care and interoperability are two parts of the same equation. And as the industry moves forward with increased efforts towards interoperability, this in turn pushes for an increase in value-based care and vice versa. And while we know that there's a lot changing with value-based care today, the core principles really remain, where we're looking towards an increase in interoperability and really an increase in care coordination to ensure that both sides of this equation remain successful. And now if we go to the next slide to just dive into a few high-level strategies for success and considerations that organizations can take to make sure that regardless of what changes with the nuances of value-based care in the future, they're able to focus on core strategies that are applicable across all models and are favorable in an interoperable world. And so some key strategies that really drive success across all of the current value-based care models today, as well as future success with models such as direct contracting, come down to maximizing revenue and also maximizing shared savings. So organizations really should ensure that they're thinking through things like beneficiary engagement tactics to support better retention of overall beneficiary panels, processes to support maximizing quality, as well as related quality scores, care management resources and processes to minimize avoidable utilization to increase their overall savings, as well as beneficiary engagement tactics that support proactive and preventative care, again, increasing the potential for shared savings. And ultimately, one other thing to just finally flag is we know a lot of things are changing right now, and there are a lot of updates coming around the corner and deadlines coming around the corner, such as the need for next-gen ACOs to now make a choice as to whether or not they want to continue into a direct contracting path or potentially move back into an MSSP track within the coming weeks. But overall, if you manage to keep these sorts of considerations in mind, you ultimately will be successful regardless of which program that you move into. And with that, I will hand it over to Natalie.
Thank you, Molly, and welcome to all of our webinar participants. Before I dive into how PatientPing can support organizations in the evolving value-based care landscape, I want to highlight some recent exciting PatientPing news. As many of you may know, PatientPing was recently acquired by Appriss Health, a leader in cloud-based care coordination software and analytic solutions focused on behavioral health and substance use disorders. Our combined organizations create the largest and most diverse care collaboration network in the country, connecting close to 1 million healthcare professionals across all 50 states at virtually all care settings, including primary and specialty care, emergency departments, inpatient facilities, skilled nursing facilities, post-acute facilities, behavioral health treatment centers, pharmacies, home health agencies, and state health agencies. This transformative combination of leading cloud-based care coordination software and analytic solutions will help us deliver on our shared mission of facilitating care collaboration, lowering total cost of care, and improving outcomes for patients across the physical and behavioral health continuum. We're thrilled for the future of the combined organizations and the impact on patient outcomes. Focusing just on PatientPing today, PatientPing connects providers across communities and across the care continuum to enable seamless collaboration and care transitions. We do this through our national data network and engaging software applications that enable real-world coordination workflows. Knowing where patients are receiving care in real time enables providers to thrive in both fee-for-service and value-based care environments, including the programs that we've discussed today, and ensures that patients are receiving critical care when and where they need it. PatientPing is powered by the nation's largest network of ADT data. We have the most robust national ADT network across the care continuum, composed of over 1,100 hospitals, 7,800 post-acute facilities, and 300 provider organizations. Our network covers over 43 million patients nationally, and we've processed over 135 million patient ADT events over the company's 7-year history. Now, as Molly discussed the evolving value-based care landscape, access to real-time data and insights is critical to maximize shared savings in all of the value-based care programs we've discussed thus far today. In that vein, there are 3 key elements of PatientPing's platform that help drive success towards shared savings. The first of which is pings, which are real-time notifications on care events across both acute and post-acute settings. Complementing pings is spotlights, which are real-time interactive performance and insights dashboards on SNF utilization, readmission rates, and multi-visit high-utilizing patients. The data that powers both our pings and spotlight solutions come from our diverse and robust national network of engaged hospitals, post-acute facilities, and provider organizations. Now, focusing on pings first, pings or real-time notifications power targeted care coordination for attributed patients. Your team will receive a notification in real time anytime an attributed patient experiences a care event in an acute or post-acute setting, including ED presentations, observation admissions, inpatient admissions, discharges to post-acute facilities, and discharges home. Pings enables real-time interventions and drives first, reductions in avoidable admissions and readmissions, which results in direct shared savings. Second, reductions in post-acute utilization and length of stay, also resulting in direct savings for shared savings participants. And then finally, increases in beneficiary engagement for enrollment in care management programs, ultimately reducing avoidable downstream utilizations to drive savings. And what makes pings really powerful is that they are surfaced to users as streamlined, actionable insights. Users can filter their pings feed to surface top priority events for intervention or follow-up. By leveraging filters based on diagnosis, care setting, facility, payer, and more, users can customize their views to efficiently identify the care encounters that require highest priority care management resources. Additionally, pings also include smart flags, which dynamically flag utilization that may require priority intervention. These flags will automatically tag patients that are high utilizers, readmission risks, and patients with a recent inpatient or SNF stay. By seamlessly integrating into user workflows, pings enables care managers to efficiently prioritize and engage with patients in real time. Spotlights are real-time and interactive dashboards support macro-level organizational coordination. There are 3 Spotlights dashboards, all of which provide real-time insights on macro-level trends and the ability to drill down to facility or patient-specific insights. The SNF management dashboard provides a month-over-month view of SNF readmission rates, average length of stay, and admission volumes. Users can drill into each metric to view a breakdown by individual SNFs and further drill into an individual SNF's data to surface patient care events. This dashboard enables macro performance tracking of SNF facilities and effective collaboration with SNF partners to discuss performance improvement opportunities. The hospital readmission rate dashboard shows overall readmission rates by month, and users can drill into each month to view the breakdown of readmission rates by hospital. Users can then drill into each hospital to view individual patient care events. This dashboard supports the real-time identification of readmission rate trends and powers performance improvement initiatives to reduce beneficiary readmissions. And finally, the multi-visit patient dashboard displays utilization patterns within a patient population. Users can quickly view the number of patients visiting a hospital with buckets for patients with 2 visits, 3 to 4 visits, 5 to 8 visits, or 9+ visits in any given time period. You can then drill into any of those buckets to view the individual patients and their specific care events. This dashboard supports the rapid identification of high utilizing patients and enables organizations to efficiently direct care management resources towards the highest impact patients to decrease avoidable utilization and costs. PatientPing's national network powers Pings and Spotlight's ability to surface comprehensive real-time insights. But beyond that, our network also consists of engaged stakeholders facilitating bidirectional care coordination. With PatientPing, you have the ability to push critical patient information to other treating providers across the network. When you do that, any PatientPing user can quickly see critical information for a patient presenting at their facility. To illustrate what this looks like, an example could be a patient is admitted to a skilled nursing facility. Upon admission, the SNF is able to view that patient's attribution to your ACO or organization, your care team's contact information, care instructions, and full encounter history. That context supports the SNF care team's ability to effectively coordinate care and drive an optimal patient outcome, ultimately reducing the risk of a downstream readmission and avoidable costs. So pings, which drive targeted beneficiary intervention, plus spotlights, which drive facility level coordination between hospital and post-acute organizations, plus our national network, which enables bi-directional care coordination, powers rapid performance improvements and savings opportunities through, first, reduction in avoidable hospital utilization, second, reductions in avoidable post-acute utilization, and third, patient engagement for care management programs. PatientPing has historically generated substantial savings for ACOs, and we partner with many of the most successful ACOs to drive shared savings. In 2019, PatientPing's network of next-gen ACO organizations earned over $260 million in shared savings, and more than half of the top 20 ACOs that earn shared savings are part of PatientPing's network. Additionally, PatientPing customers achieved an impressive 93% average pay for performance quality score. Also in 2019, PatientPing's network of MSSP ACO organizations generated over $517 million in shared savings and made up nearly 50% of the top 15 MSSP ACOs. We look forward to continuing to support success for participants in existing and new alternative payment models. And to demonstrate what some of these aggregate savings look like on an individual participant level, I'll highlight some key data points from case studies we've done with a few of our ACO partners. Houston Methodist Coordinated Care used PatientPing to generate $681,000 in savings by reducing their average post-acute length of stay from 25 to 21 days. Additionally, they doubled the number of participants receiving care in their preferred network of post-acute partners using PatientPing. St. Francis Healthcare Partners saw a 24.7% reduction in 30-day hospital readmission rates from their preferred post-acute network and a 27.5% reduction in post-acute average length of stay as a result of using PatientPing. Pioneer Valley Accountable Care used PatientPing to reduce SNF costs by 25%. So in summary, we know that the value-based care landscape and CMS models continue to evolve. And we also know that the push for interoperability continues to increase. These market dynamics support and highlight why effective care coordination is so important and also empower the ability to do so effectively. PatientPing continues to partner with many of the most successful value-based care participants to support best-in-class care coordination models. Through PING's real-time notifications on care events in acute and post-acute settings powering targeted beneficiary intervention, Spotlight's real-time interactive performance dashboards on SNF utilization, readmission rates, and multi-visit patients, supporting hospital and post-acute facility level coordination, and a national network made up of hospitals, post-acute facilities, and provider organizations enabling bidirectional care coordination. PatientPing is a critical partner to ultimately reduce total cost of care by reducing avoidable hospital admissions and readmissions, reducing post-acute utilization and length of stay, and increasing patient engagement to ultimately reduce downstream avoidable utilization. And with that, I'm going to hand things back over to Chris.
Awesome. Thank you, Natalie and Molly, for the informative discussion. Before we jump into the Q&A session, I wanted to point out where you can find some of our additional resources. To learn more about PatientPing, you can visit our website, www.patientping.com, or contact us at connect@patientping.com. We also linked several resources there to review around the new CMS models, the other value-based care initiatives discussed during this webinar, And again, you will receive a copy of these slides at the conclusion of the presentation. Lastly, before starting the Q&A session, we wanted to launch a quick poll for those of you who are interested in connecting with a member of our team after the webinar to learn more about how PatientPing can help support your organization. If you're interested, please click yes when prompted by the poll shortly. Great, thank you for your answers. So let's just see. Let's just jump into the Q&A. And those of you that have said that you would like us to contact you, we will certainly do that within a few business days. And if we've had quite a few questions submitted, I can see, and just as a reminder, we encourage you to submit them via the control panel on the right-hand side. So I think the first question here might be for you, Natalie. Let me just pull this up. Sorry, just having a little bit of problems here with the computer. Running a little slow today. Okay, here we go. So Natalie, this one's for you. What information will I see in patient-specific event notifications?
Yeah, good question. So each ping will give you visibility into the type of care event, event location, diagnosis information, and any up-to-date contact information for that patient. For further clinical context, you'll also have the ability to view that patient's care team information and full encounter history on their actual profile within PatientPing as well.
Got it. Thank you. Molly, this one appears best for you. Does CMS plan to expand the interoperability requirements from the e-notifications condition of participation to apply to other types of healthcare organizations?
Yeah, absolutely. And so while CMS has yet to release timelines around expansion of e-notifications for COP to apply to other types of healthcare organizations, in that recently released interpretive guidance, it does highlight ACOs and ACO-related distribution lists, which, as I had mentioned before, really indicates their consideration of these providers as essential to care coordination and laying the grounds for future expansion to include these and other provider types. So, short answer is not yet, but it certainly seems like they are planning on it in the future.
Okay, got it. This is more of a question about PatientPing, and Natalie, I think it's best for you. Do I have to use PatientPing software, or do you integrate with other platforms?
Yep, so PatientPing's data can definitely be integrated into other systems. Our Spotlights dashboards do require use of the PatientPing platform, but we do have flexibility on our delivery of the real-time notification data. We can do HL7-based integrations and also do Smart on Fire integrations into EHRs. We also offer data delivered via a nightly SFTP file as well.
Got it. Excellent. Molly, this is about direct contracting. Can a DCE participate in professional risk option and later move to the global risk option?
Ooh, that's a great question, and definitely in light of the quick turnaround times for next-gen ACOs that are looking to move into direct contracting following Friday's guidance, I'm sure this is a question that will come up with a lot of organizations. And so essentially, if a DCE or a direct contracting entity initially joins the program under the professional risk option, they will be able to switch to the global option for the following performance here. But definitely want to flag that it does not work in the reverse. So if an organization opts to choose the global option as their first performance here, they are not able to move back into professional once the model starts.
Got it. Okay, that's great information. Thank you. Let's see, another question here. Natalie, I think this is for you. Are hospitals using PatientPing to be compliant with this COP rule?
Yep, good question. The answer is yes, and many do. So last year, PatientPing released a product called Route, specifically for compliance with the COP. Route is basically a single but comprehensive solution that can guarantee full compliance for all aspects of the rule. So everything from delivering e-notifications to patient-identified providers or requesting community provider groups to audit reporting. Route is a simple solution for compliance with the new rule for hospitals.
Excellent, thank you. Let me see if there's any other questions. Nope, nothing's come in. So without any further questions, then this concludes our webinar. Thank you so much for your participation today. As a reminder, you will receive a copy of the presentation and slides from our team shortly after this call ends. So please don't hesitate to reach out if you have any questions. Thanks a lot and have a good rest of your day and enjoy the long weekend.